Hi, my name is Will Maclean, and I'm going to be teaching a seminar on lingering pathogens for eastern currents starting in May of 2013. For the clinicians amongst you, how many times have you had a patient come to you and say, "I've never been well since"? If you've heard this, chances are your patient has been suffering or is suffering from a lingering pathogen. A significant proportion of people who make statements such as this have lingering pathogens. They're a very common and often unrecognised cause of chronic illness. The concept of lingering pathogens is quite old. In fact, it can be traced back to the Neijing and even further back to the Shang dynasty, where people used to talk about goo poisons or goo toxins, which could invade the body and cause chronic wasting, chronic illness, and even death. The model, though, the idea behind to analyse lingering pathogens effectively has sort of never been strongly developed in modern China. So the idea is a bit vague and difficult to use effectively in clinic. I've spent the last 25 years in practice trying to work out how to analyse these things more efficiently. And I've come up with a simple model, which is very user-friendly, easy to use in practice, and it makes the process of diagnosis and treatment of a lingering pathogenic entity quite easy. So in this seminar series, over the course of 5 weeks, we're going to be exploring the most commonly seen lingering pathogens, the ones that I'm most familiar with in clinic. And we're going to learn a simple and user-friendly model for determining where exactly in the body these lingering pathogens end up and what type of pathogen that we're dealing with. We're going to look at the various diagnostic parameters that will help us to identify whether in fact a lingering pathogen is present in someone's situation. And once you've identified the location, the nature of a lingering pathogen, then we're going to look at specific tools to get rid of them from the body, and some very particular diagnostic techniques as well. This is a very practical seminar and one that you will come away with being able to apply the next clinic day. It doesn't matter if you're an acupuncturist or a herbalist, the basic ideas, the theoretical models and the techniques, the strategies are equally applicable. And in fact, we'll be looking at both herbal strategies and acupuncture protocols, which enable us to eliminate lingering pathogens from the body. I hope you'll be able to join us in May for what I think will be a very interesting series of talks on lingering pathogens. See you then.